Zone 3 Podcast. I am Robert. He
Yes.
is. And today we are joined by none other than Dr. Fahrenholtz, who's a physicist that we actually work with at our facility. So he is a physicist by day and podcast fan by night, right? Our podcast.
I've been a watcher.
And I got a big recommendation. Everyone who even knows an MRI physicist, you're an MRI tech, make sure you make them your best friend. Because, man, having an MR physicist that you can just reach out to and ask questions is invaluable.
And I'll stop texting in the middle of the night. I'm sorry.
Hate that.
You up? If you would just kind of introduce yourself. Today, first of all, we're discussing MRI physics, basic physics. Hopefully it appeals to some of those new students and just maybe patients that are curious. We get questions asked all the time by patients.
Right.
So introduce yourself if you would.
Yeah. So I'm Samuel J. Fahrenholtz and Ph.D. I work with MRI and also other modalities. What else do you want to know right now?
When you're at the grocery store, do you introduce yourself as that, Samuel?
No, usually
PhD.
like Sam.
Just hand them your driver's license.
Right.
If I was PhD, I would be saying it everywhere. But very cool. I'm very excited to have you here today.
Yes.
Like we said earlier, a lot of people have a lot of questions about this, and we can dumb it down, or we can get really involved. But what we want to do is somewhere in the middle. So feel free to kind of just take it anywhere or start it anywhere you'd like.
I got a big question. And I know that a lot of MRI techs kind of know how to answer this question. We get it from patients. But the hard part is where do you find the sweet spot in the details, right? So we can start off right off the back with, where's all that noise coming from? Like, why is MRI so loud?
It is loud.
Right?
It is loud. You
tough.
got a lot of different gradients going. So the gradients are part of the phase and frequency encoding.
All right.
Also slice encoding. And when those are running, there's current, like huge currents, by the way, running through coils. And whenever, this goes back to like sort of basic electromagnetic physics, whenever you have a current loop with changing currents, it'll change the magnetic field. And if you have a neighboring coil, it's experiencing those changes. And it'll start a sympathetic or like inducted. Inducted is like the word. Yeah. Inducted.
Is that Ampere's law by chance?
Oh boy. Yeah.
Nice.
That's a rhetorical question. I know. I'm just trying to sound smart.
Yeah.
It's only because I researched it last night.
Yeah.
But yeah, it sounds like that's exactly what you're describing.
Mm-hmm. And that phenomenon is causing pushing and pulling on all of those elements. And that's why it knocks at that rhythm, the clank, 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 clank of whatever is firing in there.
And that's why it changes.
That's why it changes depending on pulse sequence and all that.
Okay, because like the way I always describe it to patients, and please feel free to tell me I'm an idiot, but I tell people it's that we have
Hamsters.
Hamsters.
little people. Come on. But basically, it's just like current changing directions in a coiled up. In coils, I guess.
Right. The quickest way is pretty much what you said is currents are changing in these coils and they push and pull.
They're clashing and vibrating on each other.
And they're huge too.
Yeah, and these are usually the gradient coils.
These are gradient coils.
Yeah.
Right.
Okay. Well, I guess that kind of Ampere's law also helps to kind of describe how the production of magnetic field is even
happening.
Yeah. So maybe kind of just get into that if you would.
Right. So if you had a constant current of like 1 amp in this coil or whatever, then there's within, if you've seen like a picture of a bar magnet, and it's got all those iron filings around it, it's that bloom of magnetism. Same thing's happening in that electromagnet. So electromagnet just means a magnet that's formed through the current or like a electrocurrent versus a permanent magnet is like what I just described where that bar magnet has the pattern. While that current is running, it supports a magnetic field. And in an MRI, the superconducting part is what we would call the static field or the B0. B0.
Main magnet.
The main magnet, all of these words is what we're talking about with that. It just always has a static magnetic field in there. The gradients then will just perturb it a little bit. So if you ran like in the superior inferior direction, so down the length of the tube, you're changing that magnetic field. A lot of diagrams will show it as a tip. So you have like the higher magnetic side and the lower strength side.
Right.
And that's because the net magnetic field is like the addition of the static, the B0, plus whatever the gradient is doing.
Oh.
So I guess just in the construction of the magnet itself, what would the difference be between a 1.5, a 3T?
More net current in the superconducting coil. So one has half as much net.
So is it just like less coils or?
Actually, ask a different engineer, like an engineer, but they would have more turns or less turns. So you talk about NT in terms of like the N is the number and T is like the number of loops. If you have more NT, you have a bigger, stronger magnet.
Yeah.
Or if you increase the current, which is I in physics abbreviations, in engineering abbreviations, I.
Nice.
So more current, more turns.
Okay, and the strength of magnets that we're talking about, just kind of help paint the pictures. We're talking about typically like a 1.5 or a 3T,
Right.
standing for Tesla. For every Tesla is 10,000 Gauss.
Yeah.
A 3T Tesla would be 30,000 Gauss. Typically, the refrigerator magnet that you have at home is about a 50 Gauss. The way that I describe it to patients, and I've used this before on the podcast, but I stole it from another tech, but basically, I'll explain this to a patient. I'm like, you have the magnets that you stick to refrigerator at home. I'm like, well, this magnet you can stick a refrigerator to.
Yeah.
Dang.
And that kind of paints the picture.
Right.
So in addition to the magnetic field, what else do we use to create an image?
The RF excitation is the other major component of that. And RF is where you get your flip angles, or you kick off a pulse sequence with like a 90-degree flip angle.
Right.
That's activated by the radio frequency, the RF.
And you use the word excitation. What are you exciting?
There's a bunch of names for it, but we call them protons. We talk about we're exciting the protons.
Right.
What are the protons? They are in this little diagram of this is water in my hand. Oxygen, you got 2 hydrogens. And these hydrogens are the protons. Why do we call them protons? Because a hydrogen nucleus is simply only a proton.
One proton.
Yeah.
What is it that you choose to excite the hydrogen?
Because there's a lot of it in human bodies and you don't need to inject it. Now we're talking about what in the profession we call multinuclear MRI. That's where you talk about like sodium MRI. Like if you, I think it's sodium 23. I'm not like super up on my multinuclear stuff, but sodium would be an example of something you can image with MRI, or fluorine would be another example. But some of these other nuclei that are not just protons, you have to inject them, or they're very low concentrations physiologically versus hydrogen. The other thing nice about hydrogen is it actually produces a very high signal versus like if you had one hydrogen versus one of these other types of nuclei that you can image, the amount of signal you get from that proton is actually pretty good.
About image acquisition, right? And so you mentioned hydrogen excitation. You mentioned the use of a magnetic field, the use of RF waves.
Right.
Well, when you use all these, how exactly is that converted into an image?
Right.
Yeah.
Yeah, that's what I was meant.
Yeah, that.
Well, so unlike most modalities, so like talk just 2 seconds about radiography. It's like a digital photograph, except it's X-rays.
Right.
Or CT is the same thing where you have a detector bank and you have an X-ray tube shooting a fan beam of X-rays at it. And as that spins, there's the most basic recon is called filtered back projection, FBP. And it's a math way of adding up these different pictures into a tomographic image. A tomographic image is a 3-dimensional picture. MRI does tomographic images, but it's not it's done in Kspace. Like that's kind of like this big like mental leap versus these other modalities. Like they're in physical space, whereas MRI is done in Kspace. And we're kind of dancing around it a little bit, but Kspace just means frequency, but it's frequency not of like the proton. So that proton has a certain frequency it's running at. At 1.5, it's about 64 megahertz. At 3T, it's a higher double, 128-ish. Kspace is spatial frequency. And you use those different, the slice encoding gradient, the phase encoding gradient, and the frequency encoded gradient to set up a Kspace representation of whatever is being imaged.
Would you compare it to maybe like CT with the houndsfield units where for whatever signal it's giving back that's assigned a measurement, and you use that measurement to assign a certain gray scale?
Unfortunately, no. So CT is like the CT Hounsfield number is the comparison versus like a water baseline. It's like the attenuation effect of whatever's in that little voxel, in that little element, versus whatever it would be in water. So like a Hounsfield of 100 is more attenuating than, so 0 is baseline, and that's water. MRI is in its own kind of
Ballpark.
It's its own ballpark.
Man.
Yeah.
All right.
Yeah, I mean it's it's complex. It's even hard for MR techs to understand.
Kspace is it's definitely a beast to wrap your head around, but I feel like once you kind of get it, man, it opens up the door for a lot of the other concepts that are more useful in the day-to-day use of MR.
And I would encourage people not to get too discouraged about all these very tough concepts. Like it took many different approaches to understanding this centralized concept. Like I had to learn it from all these different views,
right?
From different authors or different, different YouTubes,
right?
And as you put them all together, you might get a better and better understanding of what's going on. And maybe we can give a shot at that today.
Yeah.
But like I said, it's we scan in 3D, so just to kind of give you a different idea of what it is that we're looking at. XYZ coordinates.
That's an image we could use.
Yeah, exactly. And we actually use these coordinates to plot where in the magnet or the bore itself that the patient is positioned. And so if they move, literally the depth of a dime, well, we're scanning in slices, sometimes less than that. So it matters. I don't know. I just find seeing this can be helpful to paint the picture.
So like Z, it's like going straight down the bore, right?
That's right.
All right. And then your X and Y is just kind of like traditional graph paper.
Yeah. Axial sliced at that position.
At that position, right?
Yep.
Well, let's talk about precession. Let's talk about relaxation. You're the physicist, so you kind of take us down that road on however you think it's best to be understood.
It's all a part of how we put the image together, right? Like we're collecting data from the patient, put it through this recon system to get this beautiful picture. But like, what data are we actually collecting, right?
Yeah. Well, it's got to take a piece at a time. The precession is there's something called the Larmore's frequency, which is like this basic equation that describes for a certain magnetic field.
You mean it's not Lamar?
Oh, no, sorry. LAR.
You're hoping to make at least one reference.
MOR. Or LeVar Burton.
Right.
So Larmore frequency is the frequency at a certain magnetic field. It's just a times the gyromagnetic ratio. It's just this constant for the different nuclei. So for the proton, it's about 42 megahertz per Tesla. And then at 1.5, that's why at 1.5 it has a certain frequency. It's because of this Larmore equation and that gyromagnetic ratio. That is the frequency at which those protons kind of like, people talk about it as like a top being wobbly.
Oh, yeah, like a spinning top, yeah.
Now, if you transmit your RF energy to get those, we've talked about flip angles a little bit. Like to get your flip angles, you actually have to transmit an RF frequency that is right at that Larmore frequency right there. And it will cause those protons to then flip if you're resonant with them at that. And I say you have to be resonant with them, and that's important for things, helps you think about like, so there's an idea of chemical shift out there. Different the protons, we've talked about only protons in water. There's protons in fat, there's protons in proteins. And they each, depending on their like microchemical and bulk environment. So the chemical environment, so a fatty acid chain has a zigzagging chain with protons lined up on it. That's the triglyceride. The glyceride is covered in protons, and those protons are at a different frequency than the water ones. So that's how things like, say, spectral fat saturation happen, is that spectral fat RF only responds to those fat protons. That frequency. And then you knock out all this fat spins with a really strong gradient. It's called a spoiler gradient, really strong gradients. And then you do your normal imaging, and now you have a fat saturated image that follows up. So that's the idea of like frequencies, precession. That's where they kind of come into play.
Right. And we pretty much need to know what the precession is, because when you're pre-scanning, right, you're kind of the magnet's tuning to your body frequency, right?
Yeah, that's correct. So it'll do things like it'll change the frequency of what it's transmitting a little bit to tune in to get like the maximum signal, and then it knows I'm right on the money.
Right.
And it can change what's called the bandwidth. It'll change the bandwidth of the RF to be tuned to just those fat protons, or it's not very often, but it can happen that it tunes to just the water stuff in there.
Right.
Or if you're not doing that fat saturated thing, you're exciting everything, it's a broader bandwidth that'll get all of those.
I see. So bandwidth is like what it's actually listening to, right?
It's
like
how wide it's listening to.
How wide it's listening.
Center frequency is what you would say is what it's listening to, 64 megahertz. And then how narrow and how tight and precise that is band.
Nice.
That's transmit bandwidth. So there's actually a lot of bandwidths in play. I'm catching myself. Normally when we're talking about bandwidth, we're talking about receive bandwidth.
Right.
So that's a different thing. So we're talking about transmit bandwidth at the moment.
Right. Nice. Dang. Right. So we're knocking that precession down, and then when we're listening, it's the amount of time it takes for it to kind of recover, and that's the signal that we're getting.
Mm-hmm. So you talk about time to echo is kind of what that is. So you've tipped it into 90, and to talk about a spin echo, a pretty basic pulse sequence, you then hit with a 180, and what happens after the 90 is looking at just one pixel in there. Mm-hmm. You can think about it as a bunch of different dials. So you have to think of a circle. How to put it? You got this dial, and you got at the beginning everything's coherent together. All of the spins that are within that pixel, all of the different hydrogens are right here, and then they kind of phase out, and that's because each of those protons are experiencing slightly different environments. And so they're each at slightly different frequencies, and they kind of spread out. And then when you hit the 180, they all flip 180 literally. Right. And so whatever differences they had are now like equal and opposite, and they refocus. Once they refocus, that's when you get your echo. And that's the time to echo. The time is from that 90 until it refocuses.
Right. And
well, like I said, we could really get into it deep or not. One thing I'm challenged with all the time is patients want an explanation in 30 seconds.
Oh, man.
Why is it so loud? How do you get the pictures? If you were an MRI tech and you were asked this 20 times a day, what would be your 30-second answer?
Well, I'm not an MRI tech, and I'm not asked those things for. So, man, I think we did have a good answer for noise, which is those coils have lots of current, and they all push and pull on each other, and frequently, like it's multiple times a second, and so that's why it's the image. I'd put it as you're looking at it like a slice at a time, and you're sweeping with different magnetic environments that will localize. It's called the raster scanning. So you have think of pixels like 256 square, and it's like scanning through with this magnetism thing, but it's not coming out an image, it's coming out with Kspace. Like it's not an image. After you do that acquisition, you have Kspace information. Right. Yeah.
So I think that's a good transition, actually, because I know you got somewhat of a presentation on Kspace. And for the record, we could do a whole episode on this, and we consider that, actually. But get into that, because I know a lot of people, I would say on average, I'm just going to make up stuff, but it seems like maybe 5 years into an MRI tech's career do they start to actually truly understand what Kspace is.
Yep.
You can turn on the keyboard for them.
Yep. Cool.
So I know there'll be a lot of questions about this. I imagine we'll even do a clip of just this segment. So,
Yeah. Awesome.
So yeah, your screen on screen. Go ahead and whenever you like.
Good. All right. So what is this starburst picture? What do you?
The Big Bang Theory.
Yes. No. Well, because we're doing a Kspace demo, it's pretty convenient to say, "Oh, it's Kspace," and you'd be right. But what image is it capturing? It's from our visual standpoint.
Looks like a T2 axial brain.
Robert is exactly right. How could you know?
He must have Kspace vision.
Yeah.
I may have looked at this presentation
just a little bit. So the Kspace on the left, almost all like real pictures that, like if you took a photograph of something and ran it through what's called a Fourier transform, a two-dimensional Fourier transform, it would look like that starburst. Most basically kind of all real pictures look a little bit like that starburst.
Oh.
But that is the data that the MRI is acquiring. So it's sweeping through those phase encodes and frequency codes are going sort of Kspace pixel by Kspace pixel by pixel to encode that. And the intensity of those are the amount of echo it receives. So like if it gets a big echo, it's a bright pixel. If it's not getting much echo, then it's a black pixel. And then once you do that mathematical transformation called a Fourier transform, it'll transform it into like what we call image space. So on the left, Kspace, on the right, image space. And that's the case for like tons of MRI images, almost all MRI images. There's things like spectroscopy, which aren't really images, but they still involve Fourier transforms. Reggie, you're about.
Yeah, no, I just so looking at this, I feel like every MRI tech wants to make it like this, like from one image to the other, like linear, right? Like that should be exactly how the image comes out. But technically, I guess each point, those are data points, and each data point represents a point on the image, but it's not actually like one-to-one, right?
Right. You're right, Reggie. So if you change a single pixel in the Kspace a lot, it will affect the entire image.
Right.
We'll see some good examples of that in a little bit. Like this.
Ooh.
So have you seen an artifact like in your
I
work?
have. Is this an example of when Kspace didn't get filled?
It has several names. I know it as like white pixel artifact. I know it as corduroy artifact. Corduroy because like the pants.
Right.
I call it white pixel because there's one pixel in there that is super bright. And I can even kind of tell you, well, because I made this demo, I can tell you what it is. But like if I was encountering this, I would know it's on towards the center. So the center of this Kspace is lower spatial frequencies and the edge is higher spatial frequencies. And it'll start making sense as we go through this. I put that really white pixel here. And because it is fairly close to the center, it has this like slower frequency versus if I shift it out to the right, now it's higher frequency. What pattern do you think you'll see?
With
Darker?
higher frequency?
So Robert says darker.
I'm going to say it's going to be the same, but the lines are going to be kind of
It'll be
different
same-ish. Well, let's just see. So the lines are the same direction,
right. Okay.
but they're much tighter.
Tighter. Okay.
And that's because as you went from the center being the low spatial frequencies, as you go to this middle distance, it's like a medium frequency.
And that's oftentimes when I see it, it looks more like this.
And that's right. And then lastly, if we move it out like one more notch way out there, it's even a little bit tighter. It's like the highest frequency of spatial frequency. And so on the left, you have this.
And does that go in like the phase direction, or does it matter?
It could happen in either phase or frequency direction.
But because it was plotted on the way it was plotted, like on that side, if we go back a slide, that's why it's presented that way. Like if in order for the lines to be in the, I guess,
Left to right.
left to right, it would need to be on the opposite side, or
If it would be, if you wanted the lines to be horizontal, would the star need to be more superior to
That's exactly right.
Ah, okay.
Yeah, Robert's got it. So we got a picture of that coming up.
Oh, okay, sorry, we're jumping ahead.
No problem. So Robert saw the first slide, but he hasn't seen the rest of them.
For the record.
Yeah. This keyboard's dead again.
Oh, sorry. Yeah. It likes to sleep so it can conserve battery. Me too.
You hit it.
Should work now.
Yeah, it should work. Is it? Oh, it's searching. There we go.
Or we might just have Dave start.
Yeah, Dave, go for it. And go to the next one. And this is like, I've talked about spatial frequencies. Like, what are they physically on the lower left? It's like that the Kspace value, its position, is about 0.5 per centimeter. Or to put it in like a more like intelligible way of talking about it, it's 1 cycle for every 2 centimeters. That is to say, from like black line to black line, it's about 2 centimeters on that picture.
Okay.
In the middle picture, it's about, there's 3 black lines for every centimeter, or say 1 black line to black line. That distance is about 1/3 of a centimeter. And the last one on the far right is there's 4 cycles for every centimeter.
And what parameter would you adjust
to make that happen?
Yeah.
That is your idea of spatial resolution. So as you increase the matrix size, you normally are thinking about it, I'm adding more image pixels. But in the acquisition side, you're actually adding more Kspace encoding positions. And as you're getting a bigger and bigger Kspace, you're capturing higher and higher spatial frequencies.
Nice.
Yep. Next slide. So this is the vertical lines. Where do you think where did I put the white pixel?
So would it matter if it's up top or the bottom, or would it be equal if you're equally?
That is a great question. So what was do you have an answer for that?
It's top or bottom?
I do have an answer, I think. So top or bottom? I want to say light or dark, but no, that wouldn't make any sense.
So
no, I don't
look at the Kspace part. If you reflect it over itself,
it's symmetrical.
It's symmetric. It actually doesn't matter where you put it. Can you toggle up one more slide, David? So I put it on the bottom, but I could have put it on the top part and it would have done the same exact thing. And it would cause that effect. And that's actually important for, there's half Fourier acquisition. So in pulse sequence that you can run, some is like partial Fourier is like one thing. That means you're catching at least half of Kspace and then say 75% more. And that part you're not acquiring, it's actually just reflecting whatever is up top.
Oh.
That's one idea. That's one thing you learn from Kspace.
Right.
Is it's just folding over whatever was there. So I put it at a middle distance and then it's there. Now where is the star, by the way?
Well, bleaked, one of the what would it be like?
Is it upper left?
Around, it'd be upper left or lower right. Or, actually, no, it would be.
An offset of approximately 4 centimeters to your left.
Hold on. This is fun for me.
This might be a while.
Well, it's obviously in one of the corners.
Oh.
That's true.
Which corner?
Upper left, upper right.
I'll say
lower left, lower right. And remember, it's reflected. So
yeah, so it's either going to be left or right. Doesn't matter. I would say that because it's so symmetrical, left to right and north and south, that it's you could get the same artifact from 4 different spots.
2 different spots. So let's show the star.
I guess it would be diagonal, the opposite.
So it is lower right is where I put it, but upper left would be exactly the same. Now, the lines show up in math speak, you'd say normal to that direction. So how to say, so you look at the origin, you look at the center of Kspace, and you point a line to where that star is, that line would go lower right. And those image space lines, the dark spot splotches, the corduroy pattern is like 90 degrees opposite that. That's what I mean by normal.
Right.
Yeah, okay, my mouse is
So
working.
it's more
So if you
of
draw a
a
line,
degree off of the
I wish I
original.
were-
here's the
corduroy
line
pants,
in Kspace, and then that line is like 90 degrees versus whatever's going on in the image space.
I got it. I got imagery in my head now.
So as it goes further from the origin, that means higher and higher frequencies, and then the direction is determined by this line. And again, this is a real artifact you can encounter once in a while. Right, next one. So now we've got a super blurry brain. What is going on with that brain?
Has to be a low res.
It's very low res.
Yeah.
We actually kind of answered it a little bit earlier. Like, how do you get higher resolution?
Right.
You image out further.
Matrix.
Yeah, bigger matrix. David, show this. So now what I did is I threw away all the Kspace information
On the
that was
edges?
outside of. Yeah, so the rest of the starburst is gone. All you get is the center part. And this is an illustration of like the center of Kspace is your
Right.
low frequencies. It also determines the contrast in the image. So, I mean, you can tell it's a brain. You can kind of, if you force someone, they might say it's T2 because it's got
Right.
that bright fluid. And so that information, the general shape of it and the contrast is determined by the center of Kspace. And that's important for your work in the sense that like, if things are going wrong with the center of Kspace, which is like where your effective echo time is, that's the data you're losing is
Right.
near the effective echo time. All right, so next one. And this is just the edges. So what do you think? What Kspace is going on here?
No. Well, center's missing probably.
Exactly.
Yeah, it's a donut. So
It's the opposite.
let's look at it. It's the opposite. So I threw out the center. Now we lost the contrast information. We lost the sort of general look, but you do see the edges. And yeah, that's what you get.
Anyone who could do that on Etch and Sketch, hey, I got $500 for you right
And
here.
it would actually, by the way, those edges would be clearer and sharper if I made a true donut, like a circle cutout.
Yeah.
Because it's square, that's why it's actually a little like shimmery and shaky on those brain edges. But I got lazy. I didn't want to draw a circle.
A
No, this
lazy
is cool.
physicist.
Yeah.
is an oxymoron.
All right. And another important piece of all this is like, where does the information come from? So when you get an echo, this is trying to tell you that on the left, as it's doing all those frequency and phase encodes, it's sweeping out and trying to listen to all those different Kspace pixels. As it's sweeping out, 99% of that area represents 77% of the total signal for this particular patient. It's different for different images.
Right.
But in this one instance, it happened to be
77% of it.
is everything outside of that, and the center has almost 25%, like a quarter of everything
Right.
is in that 1% center.
Is that why it's so much easier to do things like parallel imaging and things of that sort? Because you can get a lot of your data just from the center, and you're just kind of
That's right. So there's an algorithm for parallel imaging called GRAPPA, and it fully samples the center of it. Now, because of the way whenever you do a frequency encode, you can grab the entire line.
right.
And so if I got my mouse is working, this is great.
Hey,
So if you do a frequency encode, you're sweeping through, in this case, it would be vertical. Why do you think the up down in this case space? Why do you think that's frequency encode?
Is that square?
It's close. That's
Well-
actually correct. So there's more K-space pixels in this vertical direction than the XY. So it goes to like
Oh,
not
nice.
quite 400, and it goes to 450 here. And because a frequency code is very fast, you get this entire line, quote, for free, versus doing these phase encodes going left, right. It takes time to get to a different TR to a different TR. So if you don't have parallel imaging going on, it's only grabbing one line per echo. So if you had a true spin, like an old-fashioned spin echo, you're grabbing one phase encode per spin echo.
Right.
If you're doing fast spin echo or turbo spin echo, it's whatever your echo train is. So like echo train of 8, you're getting 8 lines.
Right. So it pretty much directly affects your scan time for sure, right?
It does.
Yeah.
Yeah. So as you get a bigger matrix,
encoding.
you got to encode more.
Yeah.
And then the last sort of step of this is we're playing around the idea of parallel imaging. Parallel imaging, if you had a turbo spin echo train of 8, and then a Grappa factor of 2, acceleration of 2, you're now grabbing sort of 16, for every TR, you're grabbing like 16 lines of this stuff per TR. And in Grappa, it starts with fully sampling the center. That's because when the engineers that made that stuff, they knew like, well, the center is super important. You don't want to miss anything.
Right.
You get all your good stuff there.
Right.
And then it sort of cheats on the edges and only is like sparsely samples it. And then mathematically, they have algorithms that fill it back in. And so how you go faster in MRI in general is just to grab less Kspace.
Right.
And like if you go from nex of 2 to 1, if you do 1 nex is to fill out that entire Kspace. If you went from 2 to 1, you only did it once versus twice. So that's how you save time there. Or so like filling out Kspace is how you can generally talk about speeding up.
Right. Well, and I know too, like when you turn on Kspace, you need a certain amount of signal too, or you get this horrible artifact, and most of your signals in the center, right? Your signal content's right in the center. So if we're grabbing that automatically, then why are we still kind of getting that? Is that like some kind of geometric issue or something?
Well, so you still need the edges because that defines the
lines,
edges,
right? Yeah.
The edge of Kspace defines its edges in the image, and the center of Kspace determines the image contrast and most of like the SNR, the signal.
The signal, all right, okay. And I know we touched on unwrapping, right? So whenever you're kind of unwrapping an image, you're pretty much, so say like on your cursor, we're at 150 at 150 or something. When you unwrap it, is it just you're unwrapping to negative 150 type of thing? Like, is that the same as 150 and 150? I guess
I could have, should have done this plot as say this goes to 400 over here.
Right.
From 200 to 400 is like the same and reflected as 0 to 200 this way. And then, half of this is symmetric with the other half. There's a fancy math word for it called Hermitian Symmetry. There's it. Yeah.
Oh, yeah.
How long does it take for you to truly understand Kspace?
I feel like let's say 3 years. I mean, that's like the short answer.
Okay. So, that's reassuring for me, by the way.
Well, yeah. Okay, like a few weeks. I don't know.
I know, right?
3, but it's always at different levels, right? So,
right.
And it depends on like how much of a nerd fight you're into, like how much detail do you care about in this conversation?
I feel like every time I feel like I kind of understand it, I'm like,
that's what I mean, right?
Yeah,
and I'm feeling a little more sharp on it because I just went through like making this demo versus like if you asked me a week ago, then I'm like, well, is it? Yeah. Anyway.
Yeah. Right. Well, and I know there's all these different algorithms that come out to kind of help with the filling of Kspace to minimize scan time and those sort of things. And I know that there's certain ways to fill Kspace that minimize motion, like doing it like
no, this
radially,
actually
right?
helps with that too. So going fast just means doing less Kspace acquisitions.
Right.
And summarizing again what those are, that means longer echo trains. So every echo train or every echo from that train is aligned in Kspace. The other one is partial Fourier, where that's where you're only acquire half of Kspace and you fold it over, or you're acquiring 75% of it and you're mathematically imagining that you require the rest of that. That's another way. And then there's parallel imaging, which is what we sort of talked about, where it grabs the center and then it only partially gets the other parts and has algorithms that fill those in. Those are the ways to go fast. Yeah.
Does SMS play a part at all?
It does. So that's a different kind of acceleration where we're talking about Grappa, which is in the slice. SMS, it stands for simultaneous multi-slice. And that is where you're like bouncing between two slices. So think of head, foot, and you're encoding a slice here, and you're encoding a slice here. Instead of missing, like skipping lines in Kspace in just one slice, you have like kind of like now I'm like, am I right about this? I'm not sure, but
your degree of offset or some sort of like
they're like complementary,
right?
That you're gridding lines from this one, and they're alias to one another, and that I'm not like really prepared to talk all about the detail of this, but they're alias to one another, and that the coils that are around it. So say it's in a knee coil or it's a multi-channel coil.
Yeah.
The local sensitivity of that coil, it'll see only a bit of depth of like part of the anatomy here. And it'll know that like, even though the image is, I only got part of Kspace, it knows where it was spatially, and it can like use that now we're talking about the math algorithms that like, unfold and do all this parallel imaging. It uses those spatial sensitivities to line up all that data to where it makes a good image. Let's say if you did Grappa without the math afterwards, and that's again, fill out middle of Kspace, but then only have like strips of the edges. If you did Grappa without the math part, you would have an aliased image, which is where, imagine that brain, you'd have like the brain in the center, and you'd have like half brain here and half a brain here. You'd have like the anterior brain here and the posterior brain here.
Right.
You have this folded up image. It gets unwrapped by those coils sensitivities, because when it does that acquisition, it knows coil 1 was like in this part of the head, coil 2 is in this part of the head, coil 3 is in this point of the head.
Right.
It uses that position information in the math that unwraps it all.
Mm. All right. Well, when you look at Kspace, and this is kind of how I kind of imagine it. So when I'm looking at Kspace as that diagram that you showed in the very beginning, this very bright center, a lot of dark space around it. It's like a puzzle, right? So you take that piece of the puzzle and you bring it over, and that puzzle represents this coordinates for the image, right? And you're putting that, so you're actually taking pieces from Kspace and you're just kind of plotting your image according to the puzzle pieces that you have, right?
That's the wild thing about Kspace is one pixel in Kspace affects every pixel image space.
That's right.
It's actually vice versa too. One pixel change in image space will affect every pixel in image space. That's the nice thing. That's why I used white pixel noise to demonstrate it, is you can change that one pixel and see it
it really changes
in everywhere.
I think that's the hardest part to wrap your head around.
Put something like a cancerous tumor, like a lesion in that brain, it makes every pixel in Kspace change a little bit, that when you do that mathematical Fourier transform, it kind of like layers all those spatial frequencies together to shape out a tumor. It's kind of wild.
Right.
Also things, since it just popped in my head, things like, do you know what Gibbs ringing is? Or like,
oh yeah, the Gibbs artifact.
Gibbs artifact. So you have a really sharp edge, you have a bright spot and a dark spot, and you see those like little wobbles
you pull
along
it
it.
up real quick, Dave.
Yeah.
It's similar to like truncation, I guess.
That's the same.
They kind of look the
same
same
name.
Same name. Okay.
It's the same thing.
That's one thing about MR. There's a million
names for the same
stuff, right?
Artifact. Gibbs artifact.
Yep.
Yeah.
And those wobbles, if you had more Kspace acquisitions, it would get rid of some of those wobbles.
Do you see a good example there?
Let's look. Boy, not yet. There's a wrap. Go to the center.
Truncation. I guess.
Yeah, that one. Click that one for just a sec. That's the wrap. That's what happens if you do Grappa, but not the math that happens afterwards. And part of the math, again, is those coils, the system knows where they physically were.
Right. So it overlapped so much that it didn't finish unwrapping it, pretty much, or the unwrapping is still in the image?
Gosh, let's see.
I'm sorry, I might be...
Well, it goes back to, like, you go back to your Kspace, every pixel affects everything else. And if you have those, like, gaps in it, it leads to what's called aliasing. That wrapped and aliasing, it was kind of the same thing. And so you need the full sampling to get the good image. And the magic math behind parallel imaging is what unwraps it. Or look at the, go to the left, there's a circle with those wobbles. That's an example. And it's not the best example because it's not like a head or something, but the edges
It's easy to see
from the circle are being wobble. And that's from not having enough Kspace samples to perfectly realize that edge. If you did more and more, it gets a better and better approximation of what's going on there.
I see.
Well,
See, this is when I know I'm a nerd because I actually still find this stuff super interesting.
Yeah, it is.
you can go back to the slides. I think there's.
How does artifact, I guess, play a role in and how does it disturb Kspace to the point to where we get that distortion
effect.
artifact? Yeah, it's just no data there.
Oh well, like what artifact? I mean,
I guess that's true. Like geometric distortion, I guess.
Sure. So geometric distortion is how to say. We can talk about artifacts as a general thing. Is almost any time the system thinks the magnetic environment is a certain thing, and then it's not, that it's something else. That's one way of thinking about an artifact. And in this case, in distortion is the gradients. If you have the low side and the high side of the magnetic field, these are slightly higher frequency, these are slightly lower frequency, and this like the center of the image that you're imaging. Mm-hmm. In reality, the magnetic field could be either higher and lower than the system assumes. And so when it's sweeping out these, again, what the system is doing is it's sweeping out Kspace.
Right.
And it will put the signal from one spot into a different spot because it didn't know. It assumed that the magnetic field was like 64 megahertz plus a couple hundred hertz, but it was actually 64 megahertz plus like 400 hertz, like, something different.
Right.
And whenever that happens, it will put that signal somewhere else. And that's what happens with distortion is as you go to the edge of the field, what's going on as you go to like more and more peripheral, you got center, isocenter. It really knows what the magnetic field is at isocenter. But as you go outside, it gets less and less sure of what it is. And so there's the vendors know this, and they do a bunch of, they call them first order shims, second order shims. I mean, like there's a bunch of technology in trying to correct that, but eventually it breaks down.
Right. The further you get away from isocenter, right?
Mm-hmm.
Nice.
All that very interesting stuff, I guess. Do you think there's anything that we haven't covered yet?
There might be a few more slides. I'm not sure. Oh, yeah. Well, we kind of talked about that. Edge determines edges. Nope, there's not. I have a cactus flower for you.
Hey,
everyone loves a good.
There's a Kspace to this flower, right?
There is. I should have done.
That would have been good.
And it's just a boring starburst. Like whatever it is, whatever it is, it's just going to be a boring starburst.
Right, it's going to be the same. Right?
It's going to be the same thing.
That's funny.
Well, I think we'll pretty much wrap it up. One question that we always ask guests, and usually I prepare them for, and I didn't prepare you. So dun dun dun.
Dun dun dun.
What would you say in your career, medical career, has been the most satisfying or fulfilling moment?
So it's my PhD, the science stuff, figuring out the thing that allowed me, like, I'm going to graduate now. I was doing thermal modeling in the brain so it's laser ablation. You stick a laser in the brain and you burn away a tumor. And I was trying to do predictive modeling of that to help, like, think of it as like treatment planning, that if you knew where the heat was going to go, you could maybe do better treatment delivery. I thought that I had to do a bunch of phantom experiments and a bunch of like maybe animal experiments, but then a neurosurgeon from a different institution through the company we were working with, the laser ablation equipment vendor, they linked us up with this neurosurgeon, had data from patients that I was able to like learn. It wasn't AI, but it's the same idea of like you learn from these examples that were already done in people to like make my model work way better. And so I didn't have to do a bunch of other stuff and get to like using human data. And that was like the switch flipping. I was like, I'm going to solve this. I'm going to figure it out.
I
Nice.
figure it must have been a problem-solving situation of some sort, right?
Yeah,
Seems
yeah,
like
that's
you're
right.
a good problem solver. I don't know, Reggie. Anything else?
Yeah, I mean, any advice or any resources for anyone who's still trying to figure out Kspace? Anything you think?
Links in the description.
Yeah, I know, right?
You've done this before.
Yeah.
And speaking of
General encouragement though is take lots of different views,
All right.
and some that are really simple, some that are really complex, and read them again and again, and eventually,
Picture will paint itself.
yeah, that's right.
Nice.
interested in it is probably half the battle, though. And a lot of people are interested, but yeah, just take the time, and seek out that information, I guess, right?
Yeah, it's just not a 1-to-1 ratio, which it was the hardest thing. Because I still want to say this pixel goes here, this goes there,
Right.
but it's not like
It's
that.
not like
so just get you started on the right foot. Don't think about it.
Thank you. We've been meaning to do an episode like this for a while. We've actually had tons of people, so stop bothering us. We did an episode, MRI Basic Physics. So thank you for joining us, Dr. Fahrenholtz. We really appreciate your time here. We also really appreciate being able to work with you and others like you.
Yes.
We learn a lot
Yeah, it
from
is
you
a joy.
guys.
Yeah.
Dude, yeah.
You were supposed to say the most fulfilling was working with me.
That's
It's
like
okay.
Robert Jansen.
But truly, though, thank you. Appreciate it. And Reggie, you want to say anything before we say goodbye to the audience?
No, yeah, hold on tight. I mean, MR physics is a beast, but I mean, you can get through it. So just hang in there. And like you said, just, find as many resources as you can until you understand the concept, really.
And if all else fails, get yourself a physicist as a friend. So.
Exactly.
Yep.
So thank you, everybody. Appreciate it. Thank you for subscribing. Thank you for watching us. Thank you for going to work and telling all your friends about us.
All right.
I guess that's us saying goodbye now, right?
On 3 podcasts, we are out.
Play the music.
Good.